She's rejecting the liver.
You House?
Well, that depends. Are you gonna hit Dr. House?
We're talking about it right now.
Could be Hep B, Hep C, right? It's treatable. You give her interferon, she's okay, right?
You know a lot about hepatitis.
Oh, this is getting spicy. See, earlier in the episode, the patient's brother, Sam, mentioned that there are organ black markets for livers. He tells me two things. One, he may know some people. Two, he's not impartial to dabbling in a bit of law circumvention. Sounds like he should run for office. Very excited to be reacting to House MD Season 2, Episode 8, The Mistake. On this channel, we are reacting to all 177 House videos. This will be episode 55. Let's see if I can get the diagnosis before House does as a doctor working in London. Either we're about to witness the best high school talent show performance, or we have a case on our hands. Now, it seems like at the start of the performance, this lady was feeling dizzy, took a pill, and then the intense pain started after either the pill caused the intense pain or it wasn't related. The animation seemed to show a blood vessel getting bigger. It seemed like it was in the mesentery, which is a fan-like structure that holds the bowel together. With the pain coming on so suddenly like that, the primary suspicion is vascular anyway, so my top suspicion could be a clot further down to where that artery was, which leads to the backflow and dilation like we saw. So what they showed us is like the empty shell, and then the bullet is elsewhere further downstream. Just a deduction. Maybe we can try and make a better one when we have more clues.
40% of our lawsuits last year were about House. You can't work with him, you can't work here.
Have you ever done a peer review before?
No.
May 11th.
Kayla presented to the clinic with multiple joint and stomach pain.
Something wrong?
There was some uveitis.
Oh, it's a new format episode. These are always the best. Seems like we now know the patient at the start's case turned into a full-on investigation. We know that she had abdominal pain, multiple joint pain, and now uveitis. If symptoms were a cocktail, this would be a Bloody Mary because that's a spicy mix. The reason why is that eyes aren't just the window to the soul. They can also have manifestations of many systemic diseases, especially when it comes to uveitis. That is inflammation of the front of the eye. It can cause redness of the eye, so some people can confuse it with conjunctivitis, which is your classic sticky eye, but there's a really characteristic way to distinguish uveitis from conjunctivitis. Uveitis can change the shape of your pupil. That's because the colored part of the eye, the iris, sticks to the lens because of the inflammation in the area. There are so many interesting causes of this. Infection like toxoplasmosis, TB, chickenpox, shingles, herpes simplex, autoimmune like ankylosing spondylitis, reactive arthritis because of an STI, sarcoidosis or rheumatoid arthritis. Would definitely want an infective and autoimmune screen at this point, but in the context of the acute severe abdominal pain, you would also want to make sure there is no Crohn's disease or ulcerative colitis because that could cause it as well. I wonder where it all went wrong since they're being sued and the episode is called The Mistake.
It was weird enough to get House interested.
Might not just be her arteries, could be all her blood vessels.
So, Behçet.
No, she'd have oral sores.
Or genital. Go find them.
She had some ulceration.
They were looking for sores, they found sores, but what if they mean something else? Genital sores could be non-infectious, like from Behçet's, which is a type of vasculitis, but another name for it is Silk Road disease, as it usually affects Asians or Middle Easterners. A good test for that is her hummus to pita bread ratio, and whether she has enough throat to pronounce I doubt it. So what else could it be? Genital sores could still be herpes, syphilis, vulvar Crohn's disease, pyoderma gangrenosum, or cancer. I'm going to use my first guess on Crohn's disease with vulvar involvement. It's a type of autoimmune disease that primarily affects the bowel and can cause all of her symptoms. It usually does lead to diarrhea though, but if it's affecting early parts of the bowel, that may not be a predominant feature. The best way to diagnose it would be to find an area of the bowel that is affected, like with a colonoscopy, and then do a biopsy. Treatment would be with immunosuppressants like prednisolone, which is actually similar to the treatment for Behçet's, so I'm struggling to see where that mistake will come from. Let's find out more.
I gave her some prednisone an antacid, and I ran a pathogy test on her arm. Takes 24 hours to confirm. Those little pustules mean it's positive.
I took that medicine you gave me, but my stomach still hurts.
It's a stronger antacid.
Oh, the corridor consultation is never a good thing. Seems like the patient found him while he was trying to do something else and he just wanted to get rid of her. That is not how you do medicine. When a patient mentions a new symptom like abdominal pain, headache, or knee pain, we need more information. One thing you must have seen if you've watched my videos before is that there are so many different diseases that can cause the same symptom. To differentiate between all those causes, we need to know things like the type of pain, how quickly it came on, and what makes it better or worse. We also need to examine the area. She said she had abdominal pain, so it doesn't take the second coming of Hippocrates to tell you that needs an abdominal exam. Could that have been the mistake the episode is talking about?
As little mistakes go, that was a biggie.
I just figured the stomach pain was the Behçet's. Any doctor would have thought the same.
Why did you call her an hour after she left the clinic?
But I thought she might have had a doorknob question.
Oh, the good old doorknob question. I had one a couple of weeks back. 55-year-old male comes in with a mole on his skin. We talk about it. I examine the mole and reassure him it's nothing to worry about. That's 10 minutes. And then as soon as he gets up to go and puts his hand on the door handle or knob, he then says, "One last thing, doctor. I've had this rash on my testicles. Please take a seat." That's the doorknob question. It doesn't have to be about male genitals, by the way, but calling the patient back is still a bit suspicious. We get so many of those that you wouldn't call them just for an inkling or a hunch. Would what Chase did meet the threshold of medical negligence though? In the UK, the threshold is, was the patient worse off by seeing this doctor than they would have been without medical care? In the US, there are 4 requirements that have to be fulfilled for something to be called medical negligence. So a caregiver has to have a professional duty to a patient. The caregiver must fail to fulfill their obligations by providing services that are below the standard of care. That means the care they provided would be below the level of a similarly trained professional that would have offered it under the same circumstances. Third condition, the patient must suffer damage as a direct result of that caregiver's failure. And lastly, the patient must experience harm that the caregiver can compensate them for. So we need to see what happened as a result of Chase's actions so we can decide. What's so funny here though is the patient isn't actually suing Chase, the one that actually made the mistake. They're suing House, probably because he dealt with the complaint with the grace of a baby giraffe.
Oh no! So what was her doorknob question?
I figured it might be blood in her stool.
35-year-old female vomiting massive amounts of blood. LOC at work, BP 80/20, heart rate 140. Push flows, 3 liters in the field, and we're bolusing another one right now.
He missed a bleeding stomach ulcer. Oh, that's bad. Even just feeling a pulse, doing a blood pressure, or seeing she looked a bit paler than usual could have given that away if it started with a slow bleed. To be fair though, we don't always get warning signs like that though. The AI boom is trying to prevent exactly this situation from happening. Google's CEO Sundar Pichai mentioned how AI tools can analyze more data points than doctors.
And it turns out if you go and analyze over 100,000 data points per patient, more than any single doctor could analyze, we can actually quantitatively predict the chance of readmission 24 to 48 hours earlier than traditional methods. It gives doctors more time to act.
The advanced warning triggering us to examine a patient more carefully to make sure we aren't missing red flag signs like Chase did here. Now, I definitely see why she has a malpractice case on her hands. All Chase can do now is damage control, stabilize her blood pressure, give high dose of proton pump inhibitor to reduce the amount of acid in the stomach, and try and identify the bleeding point with a scope and cauterize it to stop the bleed. Question for you smart people. What is the most common cause of stomach ulcers? Answers down below.
Coworker says she's been eating ibuprofens like candy.
1, 2, 3. Just a bad ulcer. Cauterizing. We got it.
Systolic BP 70.
Second ulcer? Not anymore. It perforated. Get it to an OR.
That is very unlucky. 2 ulcers, 1 stomach, 1 bleeding, 1 perforated. No coincidence there. Again, I think Crohn's disease is a great diagnosis here, as it can cause ulcers all the way down the GI tract from mouth to south. In real life, we would want to check for a bacteria called H. pylori here, which loves to cause multiple stomach ulcers. It can be easily eradicated with 2 antibiotics and a antacid tablet. The way H. pylori was discovered as well is so interesting. I love telling this story. A guy named Barry Marshall in 1981 began working with Robin Warren. They were taking biopsies from stomach ulcers to see what they could grow. H. pylori came up time and time again, and he was convinced that that was the cause. Gastroenterologists at the time dismissed that though and hung on the theory that it was all stress that caused ulcers. He also couldn't experiment on mice, as H. pylori only affects primates, so he recruited the only patient that he ethically could, himself. He took H. pylori from a patient, stirred it into a broth after culturing, and then drank it. He started getting unwell, feeling sick and exhausted. He developed gastritis, and when he biopsied his own stomach, the bacteria was there. So Barry Marshall and Robin Warren shared the 2005 Nobel Prize because of that. A simple cure to a common problem. Now, this perforated ulcer needs surgery, and time is very important here, as the stomach is nowhere near sterile, but the peritoneal cavity which seals it is. That means bacteria can leak out and cause peritonitis, and that can have a mortality rate as high as 50% because of widespread infection.
She got septic and damage to liver and kidneys.
Why did Chase screw up and how bad was it?
She was not fine 2 hours ago.
Maybe if she'd said something about taking ibuprofen, mentioned the rectal bleeding.
Yeah, why didn't she go to med school like you did? These are routine questions.
The doctors skip all the time.
You'd be surprised what people actually hold back from the doctor. House has this idea that everybody lies, but here he's giving the patient the benefit of the doubt that they didn't know it was relevant. This reminds me of a medical study from 2019 published in the Canadian Medical Association Journal. It tried to figure out not just if patients lie, but why they do it. We know that between 60 to 80% of patients are not forthcoming about information that could be relevant. The most common reason for this, they didn't want to feel judged or lectured. Another common reason is patients not wanting to waste their doctor's time. Some of the other things that patients hold back are that they disagree with a doctor's advice, didn't understand treatment instructions, or didn't mention avoiding exercise or having an unhealthy diet. They want their doctor to think highly of them. That's a huge reason why we're moving away from this paternalistic style of medicine where I'm the doctor and I tell you what's best. Now it's more like, this is a situation, here are your options, this is how we can deal with this together. Chase was a long way from doing that. Now, if you want us to take on this mega journey of reacting to all House episodes together, then check out the channel membership. You get early access to new videos, can take part in exclusive polls, and can request another series and episode for me to react to. The first 30 members get a chance to win a 1-hour, one-on-one mind bender tutor session with me on a topic of your choice. Currently have 25 members with only 5 spots left, so press join now to secure your spot before they're gone.
Mistakes are as serious as the results they cause. This woman could die because you were too lazy to ask one simple question.
No, she might die because I had the bad luck to spill your damn Vicodin pills.
If Chase gets any more defensive, then he needs to build a wall. What you saw here is that he clearly misdirected the conversation, minimizing the impact and trying to shift the blame to House. You see, early in the episode, House couldn't open his Vicodin, so gave it to Chase, who was a bit enthusiastic and spilled the pills everywhere. House was going to give the pelvic exam for this patient to Foreman, but then Chase got it because of that spill. Now, everyone knows that Chase is being defensive and doesn't want to accept responsibility here, and there is a core reason for that. His values are under attack. That's why defensiveness is so common. So how do you overcome when someone acts like Chase in real life? You need to reinforce those values. Chase, I know you're a caring doctor who is brilliant at their job. Even the best are not perfect, and none of that changes by making this mistake, but it still was made and you can't learn from it until you accept that. Do you see how that will elicit a very different response to, you were too lazy to ask a question? I also find it funny how House is telling Stacey all of this while talking to to a clinic patient. House even tried to distract him by making him listen to his own chest with a stethoscope. Brilliant.
None of which I'm going to testify about. Chuck, I'm going to break from the parable of the wicked doctor and tell a little story about a patient. Let's call him Buck, who has low O2 sats and crackling lung sound.
The look on his face like, where is he going with this? But the writers of House never tell you something for no reason. Earlier in the episode, House mentioned that this patient came here because it's a free clinic. No insurance required. So maybe he's addressing Buck, not Chuck, because he wants to give him some advice off the buck. Low saturations and hypoxia with crackles could be many things. Believe it or not, the type of crackle and whether it's heard while you're breathing in or out can give us a massive clue. Coarse crackles that happen on breathing out are more likely to be pneumonia or COPD. Fine crackles on breathing in are more likely to be heart failure or lung fibrosis. But you could get a more accurate differentiation by doing an x-ray, lung function test, examining the ankles, and taking a thorough history.
Buck has idiopathic pulmonary fibrosis. One transplant's about $500,000, but this poor sucker's got no insurance. If only Buck hadn't been diagnosed with fibrosis before he got insurance.
How did he know that this patient had lung fibrosis? I think House sold his soul for dry wit and superhuman diagnostic skills. Guess he traded off his flirting skills as well. Now, I saw a 57-year-old patient with idiopathic lung fibrosis when I was on respiratory medicine. He was diagnosed 3 years ago and got so breathless on walking that he had to be pushed in a wheelchair most of the time. We do actually have treatments for this condition now that slow it, called pirfenidone, which was licensed back in 2014, but they didn't work very well for my patient. He had an accelerated subtype which doesn't respond to therapies either. The only option for him was lung transplant, but one problem though, he was obese. Patients with a BMI above 35 don't qualify for the procedure because their survival after surgery would be less than without the surgery. He wanted to lose weight but found it difficult already being so breathless. Another reminder to look after our health while we have it.
That's how you tell this guy he's dying?
Relax, he's got a cold.
Good doctors don't make mistakes
Good doctors
like that.
never forget to ask questions.
Oh, my stomach. She's got ascites.
No, it's a clot. Her liver was shocked.
The patient's liver has been messed up now as well. Things are not looking good for Chase, and to add insult to injury, you can tell Stacey's a lawyer and not a therapist. Good doctors don't make mistakes like that. Cold, but is it true? A 2013 article in the British Medical Journal looked at that very question. How often do doctors get the diagnosis wrong for a new problem? In that review, they evaluated a number of sources, including autopsy data, standardized patient review surveys, imaging results, case reviews. Bringing together all of these sources, they found that 13 to 15% of doctors' diagnoses for new problems are wrong. That is a massive number. But does that translate into actual harm though? Well, the World Health Organization estimates that 2.6 million people die each year due to healthcare mistakes. That's almost as much deaths as related to alcohol. Of course, there are huge differences in global healthcare systems, but the US alone has 250,000 deaths a year due to medical errors. So why do these errors happen? Well, there are two types. Cognitive factors, where the doctor fails to synthesize all of the available data. That can be due to a lack of experience or an oversight, which makes for the majority of errors. Or system factors, where critical information isn't available or specialists are not easily accessible for a referral. So even good doctors can make mistakes, but being aware of that, trying to counteract it by being especially careful is what good doctors do. Even with the best intentions though, nobody is perfect.
She next on the list?
Yes.
But she's AB negative. Very rare.
I'm donating my liver.
The operation was a success. 2 months later, she came by for an exam. You're hot. 99.3.
People say sometimes bad things happen for a good reason. When I get patients like this who've had multiple things happen in a row, they always try to link it to something they've done. Since if it's something they've done, then we can have control over it. We're also a storytelling species. Things happen as part of a bigger picture and so must always have a reason. Randomness of the world isn't satisfying. However, accepting that randomness frees a person from blaming themselves. Some bad things may not have a purpose. purpose, but we do. We can take meaning from a bad thing by seeing the support you get from others, like Kayla's family wanting to donate their liver. We can see it as testing our character against adversity, or giving a nudge to help you decide what you want your legacy to be. I say that bad things keep happening to Kayla, but a fever in a post-transplant patient is most likely something simple, like the common cold. We would worry though, because on immunosuppressants you can be vulnerable to things like hepatitis C, fungal infections, cancers, or organ rejection. Would definitely want to investigate this with urgent blood tests, screen for infection like chest x-ray and urine dip, then take it from there. For underlying diagnosis, Crohn's still works really well, and I'm just gonna need more clues for the second and third diagnosis.
She's rejecting the liver.
You House?
Well, that depends. Are you gonna hit Dr. House?
We're talking about it right now.
Could be Hep B, Hep C, right? It's treatable. You give her interferon, she's okay, right?
You know a lot about hepatitis.
Oh, this is getting spicy. See, earlier in the episode, the patient's brother, Sam, mentioned that there are organ black markets for livers. He tells me two things. One, he may know some people. Two, he's not impartial to dabbling in a bit of law circumvention. Sounds like he should run for office. No, but seriously, when he came to say he was suitable for the transplant, he showed paperwork of the test. The team wondered why it was done so fast, and he said he knew someone in the lab. I think that paperwork was forged, and he's positive for hepatitis and gave it to his sister with the transplant. That's why he knows what to treat her with. The team did say she would die in 1 to 2 days without a transplant though, so maybe he thought he had no choice. Either way, she needs a hepatitis test, and if he could fake the virus status, then could he have faked being a match as well? Let's find out more.
You sick?
I'm tired.
You're hiding the fact that you're sick. Either you specifically asked for a tattoo of a heart that's been left out in the sun too long, or that is a really bad home job. It's a very common way of getting Hep C, which you have.
Called it. If he has Hep C, so does Kayla. So what is Hep C and why should you care? This isn't the case everywhere, but in the US, more people are dying from Hep C than HIV. It's a virus that wants to live and replicate in your liver. It has what we call blood-borne transmission, which means it can get transmitted through things like dialysis, intravenous drug use, blood transfusions, or organ transplants. With transfusions and transplants though, that was eliminated after 1992 when technologies for detecting the virus became more readily available so people could be screened. But what use of those technologies if you can just forge the test results? Crazy.
Who's gonna keep me from giving my liver?
You paid off that lab tech to say you were clean?
It hasn't been active in years. She was gonna die if I did.
Paid someone off? That is totally unethical.
It must be so easy for House to catch his patients and their relatives doing some unsavory things. All he has to do is think, what would I do in this situation? Makes for great TV. Think about it. Dexter was a serial killer and a cop. Saul Goodman, criminal and a lawyer. Hannibal Lecter, psychiatrist and a serial killer. That tension makes it so interesting to watch. What happens though when fiction becomes reality? Like in the case of Harold Shipman. He was a medical doctor who was convicted of killing 15 patients intentionally, but unofficially likely as high as 250 patients. His last ever victim was a patient called Kathleen Grundy. The big alarm bell came when she died just after his visit, and her will left £386,000 to Shipman and excluded her children. After that, the body was called in for autopsy and they found an overdose diamorphine had been given to the patient. You may know the drug as heroin. There have been a massive number of changes because of this, like increased strictness on death certificates, doctors being more cautious from pain medication prescribing, and practices moving from single to multiple doctor surgeries. House is very different to that though. Shipman was externally very pleasant and built deep relationships with his patients, externally friendly, internally rotten. House is the totally opposite. You may want to punch him, but he does what he does to do the best for his patients. Another reminder not to judge a book by its cover.
Get an MRI for him and his sister right now. I think she got cancer from you.
Your brother had an undiagnosed hepatoma that was transplanted with his liver.
Nothing we could do.
Sam found her a second liver.
She had cancer. How could
Black
she?
market.
Black market? Black market? The title of the episode is called The Mistake. Now I'm thinking, which one? Either way, black market organs are a $1 billion a year industry. If you're poor without many other options and vulnerable and someone dangles a fat check in front of you, all for the small price of a dispensable kidney, then who could say no? But a profit needs to be made, right? Well, some of these organs, like a clean heart or lungs, are sold for a whopping $130,000. A liver is just under at around $99,000. There have been scandals uncovered at prison institutions which actually run to take these organs from their prisoners and sell them to black market channels. What's even more shocking is that some of the people running these black markets are actually doctors. This episode really isn't making our profession look good, is it? But this is part of the reason why the majority of doctors should hold ourselves to a high standard, sticking to the Hippocratic Oath to do no harm and always strive to do the best for our patients. The majority of doctors do that, but as always, there will always be a few bad eggs that spoil the bat. It also makes for a better story and draws in the headlines. We call that reporting bias. I really hope Chase doesn't go ahead with this because a black market transplant is a bit mad even by house standards.
Kayla, I made a mistake. I wasn't as blunt as I should have been about your odds. My dad died, lung cancer. They even told me he was sick. You're gonna die. Alone. Thousands of miles from your children. You don't want to do that to them.
Wow, I love how the writers are bringing back what happened in season 1 with Chase's dad to this one. I'll definitely link that episode for you at the end of this to watch after. Personal experience definitely shapes how well you can relate to patients. Some of you may know that I was volunteering in a refugee camp in Calais and got some crazy stories from people there. One guy clung to a bottom of a van to try and make it across the border to the UK. Another person tried to hide in a freezer. So when one of my 32-year-old Arabic patients saw me recently and told me she was traumatized by seeing her 2 girls start going down with a sinking boat, I felt that. She held them both and told them not to panic as the sea level was rising above their heads, and then were pulled out by a Coast Guard boat. We're so glad to hear that ended well. Now, will it for Chase?
If you go home, I killed you.
You gave Dory and Nikki 3 more months with me. And when they found my cancer, found yours. And I got to save my baby brother.
How House diagnosed that cancer based on the fact that the brother had hepatitis for many years is incredible. But hepatitis over time can cause hepatocellular carcinoma through the chronic inflammation that happens in the liver. She's also especially vulnerable being on immunosuppression, which also kills cancer cells, not just invading bugs. Interestingly, one of the treatments of this cancer is also one of the causes, alcohol. An injection of extremely concentrated ethanol is guided directly to the center of the tumor. That's partly because liver cancer cells have a higher propensity to metabolize ethanol than normal liver cells and are also less able to get rid of acetaldehyde, which is a toxic byproduct. There's one for the ironic medical observations book. Maybe I should start collecting them for if I ever get consulted for a house remake. Show me your CV. Sure. Here's 55 house reaction videos. You can watch them all or just hire me.
A week later, Kayla died at home. I killed your sister. I misdiagnosed her ulcer. I killed her. I was hungover when she came back to see me.
What? If that was what Chase looks like hungover, then I want what he's having, except the malpractice suit part. Of the number of ways you could have a brunette breathing down your neck, this may be the least popular. So alcohol and doctors, we know it's a problem. In the US, around 10% of doctors have had problem drinking at some point in their careers. In France, it's closer to 13%. Post-pandemic is a tough time to be a doctor, and some people turn to substances because that's the only way they know how to cope. This is just a symptom of the bigger underlying problem of burnout. Not a viable excuse for treating a patient poorly or turning up to work hungover, but up to 30% of doctors have symptoms symptoms of anxiety or depression. There have been some positive steps though in recent years, like the physician's associate role to try and help reduce workload, the junior doctor strikes as a necessary evil to try and help pay at least match inflation, or just replace us all with AI robots. This episode has definitely taken an unconventional turn. Surely we'll find out if the patient actually had Behçet's or something else at some point.
I've seen you hungover. You weren't the day you blew his sister's diagnosis. You were depressed and distracted. Assumed you'd gotten a phone call from your stepmom.
If he had lung cancer, he would have...
What? This is the real reason why Chase had just found out that his dad died as the patient was coming into his room. Brutal. Of course, in real life, if a patient comes in unannounced, unless you are acutely unwell, then making an appointment is the best option. Where's the fun in that though? Chase losing his dad here obviously affected him, and a life event like that does make you question your priorities. Reminds me of an incredible book I read recently called 4,000 Weeks by Oliver Burkmann. He mentioned how that's all any of us have, 4,000 weeks, and proposes a few questions to help us make the most of our time. In what ways in your life are you settling for comfort? Where are you holding yourself to impossible standards of performance or productivity? In what ways have you yet to accept the fact that you are who you are and not the person you think you ought to be? In what areas of your life do you feel like holding back until you know what you're doing? Since Burkmann argues that the truth is nobody really knows what they're doing. Lastly, how would you spend your days differently if you didn't care about seeing your actions come to fruition? You may not immediately be able to answer those questions, but by doing so, it helps you to understand your finitude. That gives us the opportunity to better understand the weird and wonderful things that we are specifically put here to do. If you want to hear more from Oliver Burkmann's book, then you can access it for free with a trial of Audible Premium Plus. Link is in the description below.
Dr. Chase?
Why didn't you tell me he was dying?
He asked me not to.
Dr. Chase, your error resulted in a patient's death. Taking into account the mitigating factor of your father's death, we've decided not to revoke your privileges. The committee has determined that for no less than 1 month, Dr. House will have his practice supervised by another doctor to be designated by Dr. Cuddy.
Meet your new boss.
What? Foreman is House's boss now. This has the makings for a brilliant rest of the season. There was no room for guesses in this episode though. I guess it was Behçet's all along, so I'll take the loss. Unconventional episode, 7 out of 10 entertainment, 6 out of 10 accuracy, 3 out of 10 diagnosis. After this, you have to watch the episode where Chase's dad visits and joins the diagnostic team here.